Let's talk about thyroid blood tests, thyroid ultrasounds, and thyroid treatment. The most common thyroid blood test that's done is the TSH, thyroid stimulating hormone from the brain telling the thyroid how hard to work. Now, if there's a lot of stress in the body, then the TSH is screaming at the thyroid, make more hormone. But if we're more relaxed and everything is calm, then the TSH tells the thyroid, you don't have to work so hard today. So the TSH is an important number, but the problem is that when I was in medical school, the whole world believed that TSH ought to be between 0.3 and 2, and anything higher than 2 of a TSH was hypothyroid, and the person needed to take thyroid medicine. But now the world says up to 5 is allowed to be considered normal. That means if the person has a TSH of 3 or 4 or 5, they don't have a thyroid problem. But before they did. And if you're a pregnant woman, you must keep your TSH below 2. If a pregnant woman has a TSH of 3, 4, or 5, you better believe she's going to be on thyroid medicine. But what about everybody else? Why are they allowed to have a TSH of 3, 4, or 5, and they're considered normal? I think it has something to do with the insurance companies not wanting to treat everybody. But in any case, all of my patients want to have a TSH below 2. And if they don't, I'm going to help them get a TSH below 2. The next most common test is T4. The TSH is telling the thyroid how much T4 to make. But T4 is an inactive hormone. And the pill that people take is T4. Synthroid, all those are T4, levothyroxine. It's inactive. It doesn't do anything until the liver and other places in the body turn it into T3. T3 is the active hormone. But most people are checked through their TSH, and if they're lucky, they get a T4 test, which is the inactive hormone, and the person doesn't feel well, but their blood tests for the TSH and the T4 are normal because they didn't check the T3. And if the T3 is not in the upper 1/3 of normal, that could explain why they're not losing weight, or why their hair's falling out, or why they're depressed or constipated. So we need to make that T3 go up. Another blood test that's checked are thyroid antibodies. And one of the reasons it's not checked is because conventional medicine thinks that if you have an antibody elevation, you have an autoimmune disease, your body is trying to kill your thyroid, a friend that's trying to kill itself. What do you do about it? I don't know. They don't have anything. They don't even want to recheck it after they make the diagnosis that you have an autoimmune thyroid disease, whether it's Hashimoto or Graves' disease. They say, that's what we have. We don't even want to check it again because they don't have anything to do about it. But we found that if you are able to change your diet, to fix your immune system, and to take a certain special medicine that helps to lower the antibodies, that we can get people who have thyroid antibodies, TPO, anti-thyroperoxidase antibody, or anti-thyroglobulin antibody. I've had patients at as high as 8,000 and go down to normal between 0 and 30. So we check the thyroid antibodies, the TSH, the T3, the T4, and of course, we need to check all the other hormones in the body also, but when we're looking at the thyroid, those are the most important things that I look into. Now, if a person has a thyroid ultrasound that shows nodules or cysts or swelling of the thyroid, what does it mean? It means the thyroid is under stress, even if the thyroid blood tests are normal. And they haven't become abnormal yet, but the first sign of what the person notices is their throat, their thyroid is swollen, or it has nodules or cysts. That means that the thyroid is working under a lot of stress, and we have to look around in the rest of the body, whether it's the adrenals or it's the male and female hormones, the digestive system, antibodies causing all kinds of problems. And we can fix that so it doesn't progress. And sometimes they even get smaller. Sometimes biopsies are done and the person is said to have, oh, you have a nodule and you have to have a biopsy. And the biopsy, they say, well, you're pre-cancer. So let's take your thyroid out so it doesn't become cancerous. But there's now a grading system so that the doctors can't take out your thyroid unless you are very close to having thyroid cancer. because most of the surgeries were done taking out the thyroid. The person had the possibility of never coming near thyroid cancer, but they now don't have a thyroid. But don't worry, we have T4 to give to you and not the whole complement of thyroid hormones. Now, when a patient comes to me and we're working on all the different hormones, the treatment can be different for every person. Sometimes their T4 is really all they need. Sometimes they need T3 by itself. Sometimes they need T4 and T3 together. And sometimes, and most of the times, they do much better when they're taking a natural thyroid hormone pill that has all of the hormones, T1, T2, T3, and T4, along with calcitonin and all of the cofactors. It really gives the full complement of hormones when we're helping the thyroid aspect of the total health. That's a pill called natural desiccated thyroid, and it comes from a pig, but it also comes from a cow. And it's very scientific. We know how many micrograms of the T3 and T4 are in every pill. It's reliable, and some of my patients get that also. So that's a little bit of a rundown, a brief rundown of thyroid blood tests, thyroid ultrasounds, and thyroid treatment.